morning, and thank you for giving me this honor to speak before you in this segment. Now, education has always been at the top of my agenda since I joined the public sector in 1998. I came from a family of teachers. My father was a pioneer teacher of one high school in the province. My mother became a retired regional director for music of Northern Mindanao. At that time, Caraga was still part of Northern Mindanao. I used to teach when I was in Manila in law and in my early years as governor here of Misamis Oriental. Kaya ang aking brand of service focus talaga on education and health. No? And itong panahon, these two services are the most critical, the most important in this part of our history. Now, let me begin with the first slide. Region 10, Cagayan de Oro is the flagship. 5 provinces, Misamis Oriental, Misamis Occidental, Lanao del Norte, Bukidnon, and Camiguin. Although in the map, I included Lanao del Sur. Lanao del Sur is already part of BARM, but Lanao del Sur used to be one with Lanao del Norte. And just that Lanao del Sur opted to be part of ARMM, but now with BARM. But Lanao del Norte opted to stay with the region. And but in any event, that did not remove Lanao del Sur from the map. Kaya sa akin dito, when I ran for mayor in Cagayan de Oro, I had in mind the bigger picture, the entire region, including Lanao del Sur. I had served as governor of Misamis Oriental, much bigger than Cagayan de Oro. Pero I thought Cagayan de Oro would be very strategic in many areas, no, the flagship city, etc., etc. So kasama ang Lanao del Sur. And itong webinar ninyo is very crucial given we may have all the plans for education, alternatives can be put in place, but still the fundamental principle should be health. No? Hindi pwedeng i-sacrifice ang health. Kaya we're doing everything we can to strengthen the health condition of the city and to the extent that we can help sa region, especially in this very difficult time. Ito yung mga challenges namin. And I'm sharing this with you dahil sa akin, while may strategic plans na sa education, but I would like to focus the discussion on health. Dahil ito ang, like I said, the foundation. Now, Cagayan de Oro, like I said, the convergent city, trading hub, etc. Pero magandang advantage during good times, but very challenging during difficult times. Very challenging. And because it's the business center, education center, etc., everybody's here. And Cagayan de Oro is the host of the Northern Mindanao Medical Center. Actually, in this part of the country, in 1917, during the early years of the American era, they put up their first public clinic here in Cagayan at the time. And that clinic is now the Northern Mindanao Medical Center, the apex hospital of the region, and I would add even of the upper half of Mindanao. And nung una kasi sa Spanish time, ang headquarters nila was the town of Misamis that became the first city and renamed to Osamis City. And Osamis City is very strategic for defense purposes because it's protected by Pangil Bay. But Cagayan accessible from everywhere. No? So when the Americans decided to put up their first public high school, they decided to put it up here in Cagayan. And the public clinic was also put up here. Now, in the beginning, we were like in the midst of total darkness. Wala kaming testing capacity. We would send our materials to our ITM, and then when the lockdown happened, we had to send them either to Davao or Cebu and would wait for at least 2 weeks. As early as February, I wrote the DOH asking that we be provided with a testing facility. Pero ang hirap talaga. No? But anyway, so we had to live with that. No testing facility and COVID referral hospital, not just of the region, but sole COVID referral hospital for Cagayan and Misamis Oriental. Very, very difficult challenges. And so we adopted some strategies, and the next slide would show us yung ating strategies, principally on risk communication. Nag-umpisa kami March 13, and every day except only Sundays and last Good Friday, we would have our daily press briefing with the DOH Region 10, Northern Mindanao Medical Center, police, and the City Health Office, and initially pati yung Vice Mayor and some members of the council. And my idea was, kailangan the people are informed promptly, regularly, and of course, truthfully. So, niyaya ko yung ating mga kasamahan. We started that March 13. And you could just imagine how difficult it was. So many questions that we did not have any answers to. But that press briefing, daily press briefing, proved to be very, very useful to us. Dahil ginagawa namin ano yan, yung Northern Mindanao would update us on all the admissions sa kanilang ERID section, emerging and re-emerging infectious diseases. So since January 31, all of the patients na pumasok sa ERID section ng NOMC were reported in that press briefing. So we would have the chance to study its case, no? And then at the time, hindi pa namin alam kung positive or negative. So upon entry, we would already start with the contact tracing upon entry, no? But the DOH Region 10 also provided us with the technical support. They also gave us with the picture on the wider scale, the regional level. And then we would also present the picture at the city level, no? Timely, complete, truthful, and regular communications. Itong daily press briefing, up to now, we're still holding them. And we had our 127th already. 127th. And in 1 hour, by 12 o'clock, we will be having another daily press briefing. Ito yung mga strategic achievements that I'd like to point out for this session. Number one, early on, we had a problem when the DOH announced na lahat ng secondary and tertiary hospitals will be COVID referral hospitals. As I've said earlier, Cagayan de Oro is the hospital care center of the region and even of the upper half of Mindanao. Marami kaming secondary and tertiary hospitals sa private sector. But you know, when the DOH announced that, the first reaction of the private hospitals was one of serious objection, violent objection. Of course, they knew how infectious the virus is. No? So, kaya pumunta sila sa akin and asked me na it will be chaotic and messy, etc. Ayaw nila. So we were faced with a problem. How can we make them agree in the meantime? No? So mabuti na lang ang DOH had adjusted their position. So we were able to come up with an agreement the DOH, the Northern Mindanao Medical Center, all the private hospitals in the city, and city government that also owns a city hospital and the city health office, we agreed na NMMC shall be the sole COVID referral hospital. But in return, in order to decongest Northern Mindanao Medical Center, we would really strive to absorb the minor cases of Northern Mindanao Medical Center. Also, private hospitals agreed. Ngayon sa akin, yung City Health Office, we mobilized really hard selling to the people na doon na mga anak sa aming health center. Little did I realize na by May and June or June, July, we would hit record levels sa childbirth, no? Record levels never before achieved in the history of the city for 2 consecutive months. Bumaba lang in the last month, July, because of the campaign against polio. But I expect na aakyat na naman, no? So that proved to be very crucial, and I understand na in some areas, no, yung may epicenter of the virus, isa sa mga problema is alat ang referral hospital. So the problem of stress really is inevitable, no? And then of course, as many hospitals as you have, you need to spend for PPEs and for all the special equipment. So I think it proved to be very crucial and strategic for the region. Another strategy that we did was we built up from scratch. The city bought 4 RT-PCR machines para ma-installar lang. And now we have 2 of those machines are in the Department of Health Regional Office, and the other 2 will be in the Northern Mindanao Medical Center. In the meantime, there are 3 gene expert machines in Northern Mindanao Medical Center. And also a private hospital, Polymedic, has installed 1 RT-PCR. The counterpart naman ng city, we provided 500,000 and then doon i-charge yung uses ng ating constituents. And we also provided the same arrangement with Maria Reina Xavier University, amount of 500,000. Itong testing really proved to be the source of light, together with, of course, the technical supervision of the DOH, the information that emanated from the Northern Mindanao Medical Center, and then the local interventions that our team has done, no? So from total darkness, ngayon I can say that we have a good handle. We know what strategy works. We know which to adopt, and meron tayong countermeasures for situations. Third is ito yung ano, no, offensive. Dahil ang virus hanggang react na lang tayo. The virus infects a person first before you can act. So itong ano natin is preemptive. Meron tayong I call them the Rituyas Army. Yung barangay health workers, barangay nutrition scholars, mga frontliners, as well as the CDVs, the City Development Volunteers, numbering about more than 1,000. Ikot sila ng ikot sa mga barangay, house to house, parang kampanya to check kung merong ARI and ILI symptoms sa mga bayan. Another is our isolation units and temporary treatment facility. We adopted a very strong approach on the new arrivals, the ROFs and LSIs, no? Ang ano ko is tanggapin natin. Tanggapin natin para idiretso natin sa ating isolation unit. And then after a few days, i-test sa RT-PCR, meron na tayong testing. Kung negative, let them go home. Kung positive, then doon sila sa TTMF. Ang ano ko, pagdating sa airport pa lang, sa port facilities pa lang, aakitin na sila to join us in our isolation quarantine area. Dahil worried ako na if you allow them to go home, kung positive, delikado na and you'll end up with local transmission. So that proved to be, it's doing well. It's doing well. And so we adopted strategies to make sure that there will be available space in our city isolation unit. And then we also have this limited and focused containment. Others call it the granular lockdown, no? And then also the agreement among the hospitals and city health office para merong ano, no? Yung, we want the private hospitals to also be involved in a meaningful way in this battle against the virus. Ito yung example sa containment, no? Hindi yung entire barangay, but just the area that where the local case arose, no? And this is designed by our epidemiologists and in collaboration with the police and our disaster team, no? And habang naka-contain yan, walang makapasok, walang makalabas except yung authorized and hinahatiran ng pagkain. And sa awa ng Diyos, ang yung spread has been prevented. We have had siguro mga 5-6 na cases of this type, no? And of course, ang strategy niyan is yung infected dalhin na sa facility kung asymptomatic, and then yung members of the family dalhin na rin sa quarantine. Ito yung sample ng ating intensified surveillance. The first 3 lines, actually, these are the 3 groups that do the surveillance. The 4th line is the total households, no? So a total of 203,000 households. Cagayan de Oro's households only mga around 150,000. So nakaikot na yan, some of them. Yung dalawang lines where nandun yung 3.22, ito yung 3.22% represents those who have not been addressed yet by the health personnel. Dahil the 3 groups, the Rituyas Army, will be followed by a health team of our city health office to address the findings that they have uncovered. I just want to show you some slides dahil minomonitor ito and nire-report ko sa ating mga kababayan and also for the entire region. Dahil every press briefing, my report covers 3 areas. The region, Northern Mindanao Medical Center, and then Cagayan de Oro City. Now, ito yung example sa region. Lumalakas, maganda ang recoveries, maganda rin ang outpatient. Ito yung mga ROF LSI. Konti lang ang admitted, no? Although nag-increase ito ngayon, but that's relatively small. Itong outpatient, ito yung naka-quarantine, no? Mostly the ROF LSI. And ang strategy namin sa city is, like I said, tanggapin namin. We never said no. Dahil sabi ko, where will they go? Number 1. Pangalawa, will just be, this is also our way of helping Metro Manila. Sabi ko, Metro Manila, Calabarzon, more than two-thirds of the economy nandyan sa ating bansa. And kailangan natin ang ekonomiya na umangat. So tulong tayo in the unloading of potential problems doon sa Metro Manila. Kaya okay lang na umuwi and we will attend to them. Ito yung sa Cagayan de Oro. Ito yung chart. Again, the blues are the ROF LSI. The red ang local cases. And then yung green is the total number of COVID cases. Yung taas, the figure, ito yung percentage of the ROF LSI vis-a-vis the total cases. You'll please note na ang ROF LSI has been steadily increasing. Pero sa akin, okay lang. Basta masikaso natin, huwag lang silang umuwi sa kanilang bahay. And then, maintain the the local cases at manageable level. Diyan sa 33 na yan, 5 na lang ang active ngayon, ang active cases. Ito yung sa Cagayan de Oro City, ito yung naka-quarantine, yung outpatient. Sa awa ng Diyos, wala nang currently admitted. Yung naka-quarantine, total of 67. Meron akong mga milestones na kailangan na mas lilipat na yan sa recoveries. Dahil every reduction sa quarantine is an improvement sa recoveries. Ito yung yung aming CIU, City Isolation Unit for the ROF LSI. Ito ang test, wala pa itong, hindi pa to positive. Just new arrivals, no? And we put them in an isolation unit, and then after 5 days, we have them tested, RT-PCR. The blue lines represent the number of the ROF-LSI. The yellow lines represent those who have been tested. So far, na-swab na 270, number of ROF-LSI 525. Nag-reduce ngayon because of the lockdown in Manila. Ito yung aming TTMF, yung Temporary Treatment and Monitoring Facility. And all of these are run by the city government. We have a total of 90 and merong capacity, meron pa available capacity of 98. So ito lahat, inaasikaso to, breakfast, lunch, dinner, etc. And then monitoring sa kanilang health conditions. Lahat naman yan are asymptomatic. Kaya hindi kailangan dalhin sa hospital. So we are guided by the virus spectrum na 14 days, wala rin yan. So basta maganda lang ang isolation, ang quarantine facilities. Ito yung situation on the recovery at the regional level. The important lines here are the yellows and the green. The yellows represent the total recoveries. The greens are the active cases still, no? Look at the blues. The blues are the local cases. So from July 2 to August 10, increase ang recovery from 17 to 45, more than double. And then ang ROF-LSI from 19 to 339. Ang laki ng improvement, no? This is as far as the region is concerned. Ito yung Cagayan de Oro, and with all humility, this is much better dahil tinan mo yung August 10, total recovery is 115, and then ang active cases 67. A little over half na lang naiwan. And now, look at the local cases from 5 recoveries in July 2 times 4, naging 20 in August 10. And then ROF, mas dali ang recovery sa ROF, LSI dahil asymptomatic naman. But they should not be allowed to go home dahil they could be infected already. Until they are tested sa RT-PCR, nasa isolation facility natin. Quarantine facility. Ito yung yung mga tested sa RT-PCR, positivity rate of 6.61 just for Cagayan de Oro alone. And ito yung sa Northern Mindanao DOH. Total of 3,500. Ito yung slide namin that our division superintendent gave me. But actually, we're helping them on the modular, etc., all options, no? In fact, kahapon, they had a meeting with them together with the representatives of the private schools dahil worrisome ang situation sa private schools, no? Maraming transfers and syempre ang compensation sa kanilang mga teachers, no? So we're looking for ways na makatulong din sa private schools dahil kasama din yan they're all in the same, we are all in the same boat together. So on the whole, ang natin far as education is concerned, alam natin in the entire country, merong mabigat na problema sa Metro Manila, Cebu, Davao, Zamboanga, and in some cases, positivity is rising. And in fact, medyo mahirap, no? Medyo mahirap talaga ang education. But there can be alternatives and there can be solutions. But I think the most important solution really is strengthen the health situation. If you are not able to do that, all of these alternatives might be very difficult to undertake. I think that's the last. So, in Visaya, we call it Dagan Salamat. Thank you very much. Good morning.
Unang-una gusto ko magpasalamat for inviting me to this webinar. Mayor Moreno, Mayor Gomez, sa lahat ng nakikinig dito. Isang malaking karangalan kasama ko kayo. Sa Malabon, yung sasabi nga yung battle cry natin, kaya natin. At natutuwa ko kasi ito ang kinuha ng national government. Kasi ang battle cry sa Malabon, walang imposible. Basta sama-sama, kaya natin. So, malaking hamon itong hinaharap natin na COVID-19. Sa totoo lang, yung nalaman natin na may lockdown yung mid-March. Pati ako mismo, nasindak ako. Kasi alam ko, napakahirap na madaming mga bagay na kailangan gawin at hindi madali. Kaya agad-agad humingi ako ng tulong. Pinuntahan ko lahat ng aking mga barangay captain kasi alam ko, malaki matutulong nila sa lokal na pamahalaan. Kaya kinuusap ko sila, personally, pinuntahan ko sila isa't isa at kinausap na kailangan tayo magtulungan. Wala nang political dito. No? Walang political aspect. Kailangan nagkakaisa tayo dito kasi ibang laban to. Itong laban na to, hindi natin nakikita yung kalaban at ang mga buhay ang nakataya. Kaya kung ano man, walang lugar ang politika. At alam niyo naman kung anong kulay, kung what party I belong to, kung anong association ko. So, yun lang, no? Talagang pinuntahan ko, kinausap ko lahat, at hindi lang yung mga barangay captain. Lahat ng tao kailangan nagkakaisa dito. Kasi iba nga yung kalaban. At kailangan tayo mag-ingat kasi hindi naman pare-pareho ang ating mga katawan. Naniniwala ako, eto nga, yung COVID education is key. So, yun ang kailangan ginagawa natin. Pinuntahan ko lahat ng ating mga kapitan, kinausap, and we talked about all of the things that we can do for the city. And in terms of relief, we provided relief. We dropped them off to the barangays because they know most of the people there, instead of the local government handling it, they would know better to service all. We started with the poorest of the poor, but eventually we had to give almost everyone. So ang kailangan, what we need is compassion and unity among all of us. The second aspect that I would like to touch on is environment. You know, with COVID now, the use of plastics has been abundant. Actually, the Kamanava area, Malabon, for those who are not familiar with Malabon, so we're part of Metro Manila. We're on the north. It's almost 20 square kilometers. Ganun kalaki ang Malabon. It's a highly dense area with a population of almost, right now, I think it's almost 500,000, 500,000 people in such a small area. And before, the 1980s, 1990s, flooding was regular. So right now, it's a rainy season. And definitely, we have to clean our waterways and all these things. But with COVID, we give relief packs using plastic now because it's the easiest and accessible. But we have to consider that plastics, the use of surgical face masks, these are polluting our oceans. In fact, now our feeding programs for both the isolation centers and for our malnourished children, we gave them utensils so they could clean it themselves. And hopefully, this would, it's a small step, but to reduce the use of plastic in this area. And the second thing I would like to touch on is the social aspect. Kasi ang social, malaking bagay, no? All sectors of society has been affected by this pandemic. Those who earn are concerned about how not to get COVID. And then sa grassroots naman, habang may COVID, paano ba? Paano ba mamuhay? How do I keep my work? So there's a big difference. So definitely, if you're well off, you could avoid COVID. You could protect yourself. You could stay in your home. But hindi naman ganon pwede. Hindi pwede sa lahat yon. Most of the population here in Malabon City, they're in the work sector. So they really have to go out. They have to earn a living. In fact, a lot of them have lost their jobs since most of them are sales clerks, waiters, they're in the service industry. So napakahirap. Ayaw natin mag-spike yung unemployment rate kasi tumataas talaga. So, ang ginagawa natin, no, sinesecure natin yung mga areas na alam natin may mga negosyo, yung mga factories. We make sure, we try to do our best. Of course, parang our best is not good enough. We have to do more. That mawala ng COVID in those areas. So those industries are always functioning. Also, with regards to the kids, because right now, yung mga batang-bata, yung below 5, they're just mandated to stay home. So the city has provided kiddie kits. In fact, we provided 8,000 kiddie kits to all the kids. So this is composed of worksheets. We're in the teachers, the daycare teachers, they deliver it house to house, or some parents would pick it up in a certain area. So this is a monthly thing. 2 years ago, we moved our ECCD learning, ECCD learning to August, to start at August. So nakapag-practice kami nung July. So monthly, binabalikan ng ating mga daycare teachers. And of course, in daycare teachers natin, even before COVID, they were given capacity building. So lahat sila, actually napapirate sila kasi halos lahat sila may let passer sila. So hindi sila tumatagal sa city. And then we provide further education for them. So they get their masteral studies as well. So malaking bagay yung mga daycare teachers. And mind you, all these people who go out of their houses, they risk their lives because COVID is present everywhere. Hindi nawawala yung COVID. So malaking tulong sila. As you know, my mom, she made the law for early childhood development. She passed away this year. And I owe it to her. So talaga tinututukan ko yung mga bata, yung mga kids before kindergarten. Kasi yung mga batang sa murang edad, yun na na-formula yung values nila. At yun ang pinaka-importante. No? Yung values nila. Para sa paglaki nila, ano ba yung tama at mali? Tama yung values. So nagpapasalamat ako sa aking nanay kasi malaki natutulong sa akin. So let's move on sa economic. Dito sa Malabon nga, sabi ko nga, madaming mga factories dito. So yun ang inaalagaan natin na huwag magka-COVID yung areas na yon. So pinapapuntahan natin. In fact, now we're doing testing. We're doing, with the help of the national government, si Secretary Vince Dizon, we're testing almost 500 to 600 individuals a day using the the swabbing. So yun ang problema kasi sa swabbing, yung resulta hindi consistent. Sometimes it lasts 2 weeks, pinakamahaba. So by the time lumalabas yung resulta, magaling na yung tao. So yun ang problema with the swabbing. We're in the process of purchasing a serology machine. It's the same machine that the Mayor Isko in Manila is using, but the results come in fast. It's better. It's much efficient, much more efficient than the rapid machine kasi yung rapid testing, madaming false negatives. So we're in the process of acquiring one, and hopefully we segregate the positive and the negatives. Because definitely, kailangan bukas ang ating mga lugar. Kasi ang Metro Manila, nakakatuwa naman, lahat nagtutulungan. Yung all LGU sa Metro Manila, nagtutulungan. Kasi nga, yung mga tao, yung free flow ng tao, open lahat yan. So yung economic, ayaw natin talaga nagsasara ang ating mga lugar kasi wala na tayong makakain. So kailangan bukas. But then, we have to maintain minimal health standards. Pinapaalala natin sa mga tao, education is key. So definitely, we have to educate the masses. What are the effects of COVID? What can be done? How to avoid COVID? So that we can open the economy. It goes hand in hand. So you open the economy, hopefully jobs are still there. and people can provide for their families. And lastly, I would like to ito ginagawa namin. I just want to show you what we're doing, helping the businesses here in Malabon. So we have this, Malabon is known for its culinary heritage. Kilala, hindi lang Pansit Malabon. So we're known for Pansit Malabon. We have a lot of delicacies here in Malabon. We have a lot of good food. We have crispy patas, sumpia, all these things. So we developed a Facebook page, Discover Malabon, and then we feature all of these products in Malabon so that even outside Malabon, people can get these products. In fact, when we had ECQ, we had this group called the Bayadihan Riders. Mm-hmm. They went out of their way. They talked to me, Mayor, they asked me if I could help them out so that they could have kahit papano konting income. They don't charge anything for deliveries. So it's up to the person to give them a tip for their service if they have to pick up something. So it's not even sure that they will make money. No, it's just that they want to give a service. Yeah. So Bayanihan Riders ang tawag sa kanila. Also, we have our fashion designers, the local fashion designers who develop PPEs and has been helping the city to protect the frontliners. Kasi yung frontliners, hindi lang naman yung mga health personnel, but also people encoding, people encoding things pag sa swabbing center, people going house to house, checking on people. So we want them safe. So I'm very thankful for our local designers for providing PPEs. So alam naman natin with COVID, money is fluid. So we want to gain another day lagi. Because I mean, all lives are important. As of now, as of yesterday, we have 2,462 cases of COVID in Malabon. And we have 128 deaths. So that's almost 5%, which is the average. But still, kahit isang buhay doon, sayang. You know, ako naniniwala, walang saysay mawala sa panahon ngayon because of COVID. So we also hooked up with the City of Malabon Business Association to ask them their inputs on how to help the business owners here in the city. They're also helping us. In terms of PPEs, food, and all these other things. So malaking tulong sila sa lungsod ng Malabon. Of course, awareness campaign about COVID. So we do that all the time. But actually, it's amazing because people say madaming pasaway. Actually, konti lang yun. It's just the same people over and over. So kailangan maleksyon, makausap, ma-explain sa kanila ano ba kasi hindi naman pare-pareho ang ating mga katawan. No, we won't function. We won't iba-ibang function ng mga katawan natin. So of course, yung mga walang sakit, asymptomatic, madali sa kanila. But yung mga madapuan ka, may sakit ka, it could be the end. So we don't want that. With the help of Mayor Benchi Magalang from Baguio, we're still trying to perfect our contact tracing. According to him, one COVID patient, we should be tracing 37 people. So right now, we're still behind. No? I think right now, we're just at 25. So we have to expand this para walang naiiwan, nasisimot yung COVID. So I go back to technology. Kasi my late mother always said, sabi niya sa akin, and she always instilled this in me, that education is the greatest equalizer. I want to add to that, no? Because hindi lang education. Education with technology will be the greatest equalizer to our unbalanced society. Hindi pare-pareho tayong lahat. And, with the use of technology, that's a big step. Like now, we have this Zoom. This is a webinar through Zoom. And picking up all these things. So we need to use technology. Actually, I'm very thankful because PLDT Smart has been helping us. All our isolation centers, we have internet capability. Even our swabbing center. So malaking tulong ang PLDT and Smart. So technology is the key. Right now, most likely there will be no face-to-face. Yeah. So we have to use digital technology. Sa ating university, the City of Malabon University, we're doing blended learning. So we acquired a learning management system. So we acquired that. customized, no? It's not the whole time the student will be using things online. Definitely, because I myself, and I think most students, they can't stay on the computer for a long time. So they have to balance this out. And as long as they do their work and give it in and they have output, I think that's the key, no? But I think that would teach them time management as well. So malaking bagay ang technology. Ito yung sinasabi kong bayanihan riders.
Yes.
So with that, I would like to thank you for this quick presentation. And hopefully you picked up something from this. Maraming salamat.
Hello, good morning. Salamat po sa invitation niyo ngayong umaga dito sa ating Zoom webinar. I was a bit late because nasa kabilang webinar po ako sa Congress because we're together with Congresswoman, we are pushing the Philippine National Games Bill, no? Kasabay ito ng this similar to the palarong pambansa, but the Philippine National Bill will be on a higher level. Kasama dito yung mga tertiary at saka mga out of school and people from the national team. So anyways, that's a different topic. Thank you so much for this opportunity to show our people, the best practices of LGU or MOC in support to the education sector and other best practices that we've been doing in Ormoc City. First of all, I'd like to tell everyone that we have a strong partnership between the LG of Ormoc and the DepEd City Division for sports education. We provide sports and technical expertise coming from international and national trainers during our training and concentration period, in preparation for the biggest games in the region, for Region 8. We provide them high quality sports equipment, which we purchase. We have created a city sports commission, and then we provide monetary incentives to winning athletes in Ormoc City Division. And then we also created a city ordinance providing sports scholarship to performing winning athletes in our city. And then as trained athletes, they have opportunity to be part of sports scholarship program to the different universities that performs or that plays in the UAP and the UAP and some of them usa. Anyways, for the collegiate sports, no. We have had a lot of players from Ormoc who's been playing already in the different schools in UP, in UST, in LaSalle, no, for volleyball, for baseball and other sports, no. And Ormoc City delegation was crowned as the Eastern Visayas Regional Athletic Association champion for years 2018 and 2019, and with a historic medal acquisition of 109 and 162 gold medals respectively, out of possible 198 gold medals. We hold regular school board meetings and we discuss matters relevant to education, and then we identify needs of the schools and provision of resources to address issues, concerns, and requests based on needs of the different schools in Ormoc City, appropriations for programs and projects and activities relative to education. And then we have multi-agency conferences and consultations to ensure that our program is effective and all projects are implemented properly. Percentage of our utilization for school year 2019 is 92%. So it shows that we have a well-executed local school board plan for programs that have been appropriated and activities that have been conducted. And then we'll discuss support of LGU Ormoc to DepEd's Learning Continuity Plan, or the LCP. Although the budget's not too big, but we do what we can with the budget that we have for Ormoc City Division. For example, we've purchased 45 units portable media library And then we procured 10 units of digital duplicators for the reproduction of learning modules, which is about 1.4 million. We've provided a computer hub for ALS learners in 10 districts, no, under the Goma Care program, which is about 2.2 million. Library facilities and equipment, about 1.7 million. Construction and repair of school buildings and other school facilities, roughly about 20 million. Then our SEF continuing legislative appropriation of 21 million. This coming from the city, so a total of about 48 million pesos. And then we also have Project Tinapa. Siguro in other parts of the country, yung tinapa is called smoked fish. Pero sa Bisaya, ang tinapa is canned fish, no? Anyways, yun lang yung pinangalan namin. So this is our project proposal. Tinapa means a tender initiative to nurture learners amidst pandemic. And for DepEd or MOOC transporters, a project in support of DepEd's Learning Continuity Plan, we shall focus on providing assistance to teachers in the delivery and retrieval of learning modules to the homes of Ormocanon learners. And the project cost is to be funded by LGU or MOOC. And then we have the Easy Aralan, the LGU and DepEd or MOOC's partnership with the Macrohon Automation and the Industrial Services Corporation on the use of a free web-based system for teachers and learners in the delivery of online learning under the new normal. Project cost for the proposal of offline connectivity and offline learning resource to be funded by LGU or MOOC. And one innovation that we're doing here in Ormoc City is the use of QR code. As you can see, ito yung mga IDs namin. Meron kaming QR code dito. This is being implemented already in Ormoc City so that we can use this for contact tracing. So as you enter the border of Ormoc, they will ask for your QR code, and then anywhere in Ormoc City, as you enter all establishments, your QR code ID will be scanned so that in case lang na merong matamaan ng COVID in one of the areas na pinuntahan mo, you can be easily notified by the LGU. We can call you or we can text you. And the nice thing about using the QR code is that the contact tracing is real time. So as you enter an establishment in Ormoc City, you can already be monitored. But we only open our database if there are reported COVID patients in a particular time in a particular area. So the database that we have can only be opened by 3 people, and with the agreement of 3 people. First, the mayor, the city administrator, and the city health officer. So that is how we use our QR code scanning system. For our health emergency relief assistance to private elementary and secondary school teachers, LGU or MOOC has come up with a fund assistance, and DepEd's conduct of consultative meetings with private school administrators in close coordination with ORMOC have opened the doors to the provision of 3,000 as assistance to all elementary and secondary educators or teachers in the city's private schools. Just about last week, I heard that the president is allotting a certain budget to give assistance to private school teachers. I think this is good news for private school teachers. No? And then the virtual workshops and trainings in partnership with DepEd or MOOC, virtual workshops and trainings on video, web conferencing, webinars with real-time messaging and content sharing were conducted here in LGU or MOOC to train teachers for ICT upskilling. It's nice now that sila ngayon, marunong na sila mag-operate ng iba-ibang applications. Could be Zoom, could be Leaf, could be Google Meeting. So naturuan sila doon. So in any modality that we use for virtual workshops or trainings, the LG or MOOC or the people, especially the department heads, already know how to host and operate such applications. For MOOC Manpower Center, we have our Ormoc City Technological Manpower Training and Research Center. We also have Ormoc City Social Welfare and Development Office. Meron kami mga vocational scholarship programs. And then we're very big in participation with other groups in Ormoc City. For example, I'll give you this Alay Lakad program with Kiwanis Club of GO Ormoc. Whenever we do Alay Lakad, meron silang binibigay na vocational courses to indigent youth, no? Since 2017 and 2019, LGU Ormoc, TESDA, and the private sector partnership, we've already had 249 out-of-school youth scholars. So, ang laki na natulong ng mga private groups and ng mga NGOs in Ormoc City. And then we've also come up with a LGU Ormoc Scholarship Program, and this is institutionalized through a city ordinance. No? So to date, since 2017 up until 2020, we've had 623 scholars already in DepEd. And then one of our best practices also, of course, itong education conference with the DepEd Ormoc, City Division, and the barangay officials of Ormoc City. Bihirang-bihira ginagawa yung pinapatawag yung mga barangay councils who's in charge of education. Dito sa Ormoc, we have 110 barangays, and we make sure that all the barangay councils are active in their own committees, whether it be agriculture, public safety, education, etc. So, sinasama namin sila sa lahat ng mga ginagawa namin. Well, especially with education, those barangay officials are very much in touch and on the ground sila to help Ormoc City and DepEd. No? So, like last August 6, meron kaming inahanda na para sa opening ng klase in the coming days. So, that's our simple and easy best practices that we do in support to the education sector here in Ormoc City. So, thank you so much at magandang umaga po sa inyo lahat.